Hello?
Hi Dad, I'm so sorry that I called so late. Are you okay? I just found out from my dad that you had a stroke.
Yes, Noel. I had stroke and fell on my head. I thought I was dead for sure. But now I'm okay. My body is still very weak. Tomorrow, I'll be going to St. Luke ElderCare for a rehabilitation exercise.
Okay, I hope the rehabilitation is okay for you. I'll call you in a few days' time. You take care, okay?
Yes, I will. Thank you so much for checking on me, Noel. I love you. Bye-bye.
Bye-bye.
Okay, slowly take your time, take your time. Good afternoon, sir. Welcome to St. Luke Elder Care Center. My name is Kyra. I'm your occupational therapist. Today we'll be doing occupational therapy assessment and some exercises. How are you feeling today?
Better, but
Better?
still weak.
Still weak? Any giddiness?
Not so bad.
Any pain anywhere?
Just general weakness.
General weakness?
Yeah, I
lah?
don't feel good.
Okay, can. Maybe you have a sit there. We take your temperature and your blood pressure first, lah.
Okay.
Okay, this way, please. Take your time to walk. Don't rush. Doing well. Take your time. Okay, so basically my role is actually to see your day-to-day activity. For example, wearing clothes, wearing pants, going to shower and feed yourself, maybe doing a bit of household chores or going out to actually be able to socialize with friends. Right? Okay, I'm just going to ask you a few questions. What kind of house do you stay in?
Stay in a HDB flat.
Oh, HDB. How many room is it?
It's 4 room.
4-room flat. Is it a lift landing?
Yes, it's lift landing.
That's excellent. Lift landing. So, is there any steps into your house at the entrance?
Yes, that's one small step.
One small steps, lah, huh? Do you have any curbs into the toilet?
Yes, there is one.
There is one curb into the toilet. Is it a very high curb or a small curb?
I don't know whether it's high or low. Maybe about
Roughly?
2 inches.
2 inches, lah. Is there any grab bars in the toilet?
No, there
No
isn't.
grab bars, lah, huh? Okay. We have this HDB East program that is actually provide the subsidies of anti-slip flooring application and also grab bars application. So the grab bars can be installed inside the toilet bowl, near the toilet bowl area where you can hold on to get on and off the toilet. Okay. It also can be installed outside the toilet so that you can hold on and cross the curb to go inside the toilet, or they can be placed around your house to assist you when necessary. This is the brochure for you to have a look. This is our occupational therapy home safety advice, just to ensure that if you have any rags or any cloths on the floor that sometimes you use to wipe your feet after coming out from toilet, try to remove it as it is a trip hazard. You might actually trip on it and fall down.
Oh, okay.
Yes. Also, for the fall precaution wise, make sure that you go to the hospital regularly for your eyes checkup. And also when you get out for toilet in the middle of the night, ensure that there's a night light. In case that you get a bit more giddy and you can't really see at night, affect your vision, the
Yeah.
night light will actually assist you to prevent you from falling also. Okay? And I understand that now we use a lot of electronic appliances. In case the cables is on the side, try to push it against the wall. It is also a trip hazard for you. We just want to ensure that you are safe at all times.
Oh, okay.
Okay.
Thank you.
Welcome. So this is our heat therapy. It will actually help you to relieve some muscle tightness and also some pain. Lah. I'm just going to apply here for you. If you feel any pain or too hot for you, inform me immediately. Okay? How are you, sir? How are you feeling?
Good.
Good. Okay, if it's still hot, let me know. Okay, I'm just going to do some trigger release point therapy for you to ensure that your muscle is not so tight. Lah, huh? How are you feeling?
Okay.
Okay, lah, huh? Okay, it's a bit of tightness. Maybe we can, later on I can teach you some exercises to do at home. Lah. Okay. Is it very painful?
A little bit.
A little bit, huh? Is it here? Okay, just gonna do a little bit of gentle massage for you. Right now, when you wear clothes, do you need help with wearing clothes?
Yeah, my wife dressed me up.
Oh, you haven't wear it yourself yet?
It's very difficult because my arm is very restricted.
I see, okay. Would you like to learn how to wear your shirt yourself?
I think that would be very helpful.
That's great. Shall we practice that?
Okay.
Okay. I have some button shirts right here. I'm just going to teach you how to wear, okay?
Yeah.
This is one set for you first.
Okay.
Okay, I'm going to have one set for myself. Firstly, orientate yourself to where the collar of the shirt is and where is the sleeve of the shirt.
Okay.
Okay, so you orientate where is the left hand side of your sleeve. Take your time. Good job.
Yeah.
That's very good. Okay, using one hand, try to roll it up a little bit. And since your hand is in this restricted position, try to put it over your hand. Good job.
Not so easy, yeah?
So easy. Take your time. Relax your shoulder. Relax yourself. Can you reach into your sleeve? Good job. You've done well.
Thank you.
It's a bit of a struggle, but practice comes perfect. Okay. So how are you coping with your day-to-day?
A bit challenging at times. And then now, because of this condition, I cannot work.
Do you have any other concerns?
Every time I come here, I have to pay. And then I go hospital, I have to pay.
I see.
And now, I cannot work, so I don't have income.
We do have an MSW, a medical social worker on board that can actually advise you more on the financial schemes and aids. Is it all right for me to refer you to them?
I'll be very happy to get help.
Yes, they will advise you more on the financial assistance part. So I'll refer you to her lah.
Thank you so much. Huh?
Welcome.
So, Mr. Peter, you mentioned that you have no income currently, and wife is a main caregiver at this point in time, right?
Correct. So even then, she cannot work so much because she has to stay home to look after me.
Okay. So currently, after what were you working before?
I'm a taxi driver.
Taxi driver.
Yeah.
Okay, it's not easy job, being a taxi driver.
Yeah, and because of this condition, now I cannot drive because once my hands is very restricted.
Sure. Right. I mean, of course, at St. Luke, for the rehab fee, if you're worried about, we can actually help you with some financial assistance. That's for the rehab services. But I will need to understand a bit about your family support. I also understand from Kyra that you have a son as well.
Yes,
and
my
how
boy
many-
is actually living in Australia, so he's not here.
Right.
So I don't think he can help.
Is he studying or working?
He's studying.
Oh, okay, right. So you used to be the main breadwinner at home, lah.
Correct.
I see. It must have been affected your family quite badly, yeah?
Yeah, that's why it's very difficult. So Kyra told me that she'll refer me to you. So I hope you can do something to help me out in my current situation.
Thank you, Mr. Peter, for your time. Thanks so much for sharing about your issues at home. So just to wrap up today's session, we talk about two aspects also. So number one is our financial concern for your rehab fee. So earlier session we talked about what are the available financial assistance that we can offer you. So in our next 3 month session with us, we don't have to worry on the rehab fees. So that one we'll review in about 3 months' time. I'll check in with Kyra. How do you progress for the next 3 months? So if there's a need for an extension, I'll see you in 3 months' time. Is that all right with you?
Yes, thank you very much.
Okay. So on the other aspect is Zarik. Okay, so over in St. Luke, we also offer caregiver support. So usually post-stroke, we also want to check in on how caregiver is coping. So I'm just going to share with you this form. If you may help, please bring this form back to your wife to fill in. So this will allow us to check in on her coping, whether or not how comfortable is she looking after you. So if let's say the score is high, my colleague, a counselor, will follow up with her. Is that okay for you?
Yes, thank you very much. I think she will appreciate you all.
Okay, great. So there are two aspects, yeah. So it's the financial and also the caregiver follow-up. So if there's no other concern, I'll see you again in 3 months' time.
Okay, thank you so much.
That's all for today. Thank you.